So your girl is trying to accomplish 2 videos in one day. But anyway, I wanted to talk to you guys a little bit about my breast cancer um, implant journey. And I just want to say that I would highly recommend getting implants because look at my drains. About to see if I can get these taken out today. So I don't know. I emptied them this morning at 6, so I think this is just residual from the drain. So, all right. I just feel like for me, it was the best thing to do was to have a double mastectomy once I was diagnosed with cancer. But it didn't come without complications. So don't worry about the complications. Just keep, going through the process of your implant. So the thing that I really wanted to note was when I got my implant a couple weeks after my surgery, I started to feel in my breast my implant was hard. It was like hard as a brick. You couldn't move it, or it just wasn't like flexible or bending. And I went to my doctor for my regular follow-ups, and I had started chemo. And when I said my implant is so hard, they sent me to a physical therapist to help massage it. And she was alarmed. A lot of people, they can't maintain their composure when there's something that's alarming to her. But she was like really shocked to feel how hard my implant was. And the nurse practitioner and my surgeon, they were unaware of what was going on. And the time was passing. Week after week, I would go to my appointments as scheduled and chemo. And I was telling my oncologist, I was like, my chest is like really tight. It's painful. It's hard for me to move. And he was the only one that really was alarmed by my implant being really hard. So a couple weeks later, I was in the recliner. I went to therapy on Friday, and I just couldn't get out the recliner for the entire weekend. And I was just so uncomfortable. And I finally pushed myself out the recliner at like 3 o'clock in the morning. And I got up to look out the window. It had snowed, and it was like I could feel something running down my pants. And I looked down at my pajamas, and they were saturated. And I couldn't smell any foul odor or anything, but it had ruptured. The implant didn't rupture, but I had an infection, and it was like a pimple that busted, and it was just oozing, and it just was gooey and everything. And I called my surgeon at like 3 o'clock in the morning. He answered me right away, and he told me to calm down and just come see him at his office at noon. He didn't want me to go to the emergency room because that's when COVID was really going on, and he didn't want me to be exposed to like potential infections or people and stuff. So when I seen him in his office, he decided that day that I needed to go to the OR so that he could remove my implant. So the process was he removed my. I've really been feeling good for like 3 weeks, and I was kept telling him that my right breast is so hard and it's uncomfortable. And I seen him last Friday, and he thought I just had a little fluid buildup behind it, but it was like the infection just kept getting bigger and bigger and bigger. I'm telling you, he was like asking me, he said, could you just look at your wound and see? And it was just squirting out. I had so much drainage. It was unbelievable. When I got to his office, he was draining it. He was pushing it out, and he could barely touch me, and I was like, ah! So he took me to the OR. He took my implant out, but my implant was fine. Apparently, my drain was removed too quick, and I had a lot of infection that was just building up and building up. So I'm feeling much better right now, although I just broke into a sweat. But look at my head. Oh, it's weird to be bald. So, yeah. Implant. I think I was off work from the beginning of my surgery till I recovered from having my implant removed, like 6 months. So during that time, I had lots of support from my family, my friends, the Pink Fund. They were very generous, and I'll leave a link to them below. They helped me pay some of my bills and stuff. Breast cancer is quite expensive, and I don't think a lot of people really talk about how expensive it is, but it's expensive. And being off work for 6 months, even though I had disability, I was only getting part-time income because I worked part-time during this time. And when I was first diagnosed and when I was off work, I had a part-time income. So nevertheless, I had to resume chemo, and then after that I did radiation. So I'm really happy that I went ahead and had the implant put back in, because I had to wait for this incision to heal. Then we continued on with my chemo. Then I went through radiation. Then I had the implant reinserted. So another reconstruction surgery yesterday, post-op day 1. Oh, look at my face. I'm just really sore. It feels like, ooh. But other than that, I feel pretty good. And so that's all I got for right now. My drains, they are, this one is the deep one. This is the superficial. I think that's what it is. Yep, this is deep, so. And I changed them this morning, but they still got a lot of fluids out. My doctor, he's going to be on vacation, so I won't be able to see him until next week, Friday, but I'm going to go see his nurse practitioner so she can change my bandage. And if my drains are good enough, then she'll remove them. But other than that, I think everything went pretty good. Surgery was outpatient. Yeah, that's all I got. Ended up being off a lot that year, and the recuperating process is long. You know, it feels like to me, what it feels like to me with my implants is having a belt tied around your chest, really tight, and you go home and you want to take, it's like almost having like a tight bra, and your bra is just so tight you can't wait to get home to take it off. But this I couldn't take off. So it's been 3 years since I had my first initial surgery, and I'm much better. For like a year and a half, I couldn't really sleep on my side. It was uncomfortable sleeping now. I really don't have the best sleep nights, but I do sleep better than I had previously. And then I have lymphedema, where I have swelling in this arm because I had some lymph nodes removed from underneath my armpit on this side. So the fluids kind of build up and you get a little swelling. Sometimes it's better than others. But lately I've been wearing my sleeve. I'll insert some pictures of me wearing my sleeve. But I just want to make sure that I let you guys know the first sign that there was a problem was I had a fever. And I wasn't feeling good. And I remember having someone go to the store and get me a thermostat from like Walgreens. And I checked my temperature, and I had a temperature of like 101.3 or something like that. And I called my doctor's office, and his secretary or whomever answered the phone was quite rude, in fact. And she was like, well, you know, something like, well, if you want to see him, you can't see him today. Maybe you can see him another day or something like that. And I'm like thinking to myself, the first sign of an infection is a temperature. But I took Tylenol, and so Tylenol pretty much masked it. she called me like a couple days later and was like, yeah, you called the other day. Do you still want to see him or something? So she really had an attitude. So, I mean, I hate to bring that in, but it's important that you know that if you have a temperature, you need to be really adamant about following up right away with your doctor or your surgeon, because that cost me having 2 surgeries, because I was taking Tylenol and pain medication, or just basically Tylenol. I didn't have anything to take for the pain but Tylenol. So I was taking almost like 3 grams a day, which is kind of, um, at the line of almost being too much. But just note that if you have a temperature, that is a sign of infection, and you should follow up with your doctor as soon as possible. So, okay, continuing on. Would I do the implants again? Definitely. My surgeon was very thoughtful and considerate, and he did everything I needed. So I had a great team. I had a nurse navigator who was also a breast cancer survivor. She scheduled all my appointments. She was there for any questions. I remember one time I sent her a picture of my boob because I had questions to make sure that it was healing properly, and she answered all of my calls. So I was really fortunate to have a really great team of people that cared for me during my journey, and my family and my friends were magnificent. I mean, they were really there for everything, all of my appointments, and sometimes you don't have good days, and some days you're just not the best, but tomorrow might be better. So don't give up. Just keep encouraging yourself to keep, pushing through, keep going, and don't take anything personal. Healthcare is really saturated with lots of patients, and during this time, it was like I said, with COVID had just started, so I had to go to a lot of my appointments by myself because you couldn't have visitors in the hospital or at the clinics. And I think it was great because it was like a nice self-reflecting time. So if you're, thinking about having implants, I would totally recommend it. It's really, it's an uncomfortable journey for a while initially, but it gets better. It gets better every day. And I'm so glad that I did it. And I know people that didn't have their implants, or they didn't want to have that done, or they just had the infected breast removed, but I just decided to do a double mastectomy. I had large breasts before, and I just didn't want to be lopsided, and I didn't want to take a chance of having to have another surgery, even though I ended up having 3. So if you have any questions, or if you need any more information regarding this, just leave them below, or you can email me. I think I have my email in there. And thank you guys so much for listening and watching my story. And yeah, that's it. Hang in there. You can do it. I did it, and it worked out pretty good. I'll insert some pictures of my journey. And my hair is coming in pretty good, as you guys can see. It's been 3 years, but after you go through chemo and you go through radiation, your hair really doesn't grow back. Our minds didn't grow back during radiation, but it eventually comes back. And at first it was like a different person. I really didn't know who my hair was because it was all white, and you go through phases. But overall, your girl is doing very good, and I'm having a hot flash, and I'm starting to I'll see you guys in the next video. Peace out, deuces. Thank you for watching. Bye.